Right to go? Okay, thanks everyone for coming along again today. I'm joined by the Minister for Health, our Chief Health Officer and our COVID-19 Commander, and I've got a bit to get through, so bear with me. There are 55 active cases of coronavirus in Victoria, including 8 new cases in this morning's numbers. 3 are in hotel quarantine. 2 were announced yesterday, being the 2 residents at Kings Park, South Bank. Of the 3 remaining locally acquired cases, 2 are household primary close contacts of a previously announced case in Kings Park. 1 is a vaccinated nurse, and Jerome will go to the details of these in a minute. We all know that since this pandemic started, distance has been one of the hardest things to live with. Distance from our neighbours, distance from our workplace, from places we love and from people that we love. We know that's been for a reason. By keeping our distance, we've kept ourselves and others safe. But we all know that Victoria is at its best when we are all together. And I know that we've all been waiting to see those people and those places that we love, which is why I'm very, very pleased to confirm that on the advice of the Chief Health Officer, the metropolitan border and the 25-kilometre limit will be removed, and the state will come back together from 11:59 p.m. tomorrow night. Thanks to the work of all Victorians, we're in a position to announce the following easing of restrictions. So for Melbourne, that will mean the 25-kilometre limit on the distance you can travel will be removed. Public gatherings will be allowed with up to 20 people, and gatherings in the home will be permitted with up to 2 visitors to a home per day, plus dependents. Additional businesses will be able to reopen, including gyms, indoor entertainment venues and electronic gaming. Venues will be able to access increased patron caps, including restaurants and cafes, religious settings and entertainment venues. Hospitality venues will be able to host up to 25 people before applying the density quotient, and that is great for our smaller venues. The rule that if you can work from home, you should work from home remains, but office workers will be able to return to up to 50% or up to 20 people, whichever is greater. Competition in community sport can return, and there is no limit on travel for sport between Melbourne and regional Victoria. So that's outdoor community competition for juniors and adults. Masks will no longer be required outdoors. However, they're still recommended where you cannot maintain at least 1.5 metre distance from others. Everyone must continue to wear them indoors, whether that's shopping or on a train or at your workplace. So now for regional Victoria, from 11:59 p.m. tomorrow night, changes include public gatherings will be increased to 50 people. Restaurants and cafes can now open to a maximum of 300 patrons per venue for seated service. Smaller venues will be able to host up to 25 people before any density quotient applies, or they can use a density quotient of 1 person per 2 square metres per venue, up to 150 patrons. Religious ceremonies will be capped at 300 for the venue. Funerals are limited to 100 people, weddings are limited to 50. Office caps are increased to 75% or 30 people, whichever is greater. Visitors to the home will be limited to 5 adults per day, plus dependents. We want to keep regional Victoria free of this virus. That's why the public health team have recommended slightly stronger settings for metropolitan Melbourne as extra protection as we run down these remaining cases. So, for example, that means for Melburnians travelling to the snow this season, that means a requirement for everyone to get a COVID test within 72 hours of departing for Victoria's alpine resorts and a negative result. It is a common sense setting, and the Chief Health Officer can speak to that later. Now, I also know that footy, of course, is something on a lot of people's minds, and while we can't have the crowds back in Melbourne just yet, we will be able to get some fans along to the game in Geelong on Friday. So we'll work with the AFL and the clubs to allow a crowd of up to 7,000 people from the region, so Colac, Otway, City of Greater Geelong, Queenscliff and the Surf Coast, to attend at Cardinia Park, provided they are members of the two clubs playing, so we can keep a very tight record of who attends. We'll continue to work with all of our sporting codes on future games and as we ease restrictions further. As we've done for the last number of weeks, these settings will be in place for the next 7 days, and as always, the public health team will review the data and our options on a daily basis. Subject to case numbers, subject to exposure sites, and always on the advice of public health, I expect that we'll be back here in another week to make some further announcements about easing of restrictions. We have to ease in a way that is safe, and we are making positive progress with the announcements that we're making, both for regional Victoria and metropolitan Melbourne. Finally, it's no exaggeration to say that the most important thing that people can do is to get tested as soon as you have even the mildest of symptoms. As we head deeper into winter, this becomes more and more important. Don't assume that a sore throat or a cough is just the symptoms of a cold. You've got to find out and make sure, and the only way to do that is to go and get tested. That might be the difference between finding and getting out on top of an outbreak or having it get out of control. So thank you to everyone for everything you've done so far to protect our state. I know this hasn't been easy, but we are getting there. And with that, I'll ask firstly Professor Sutton to go into more of the details about the restrictions and the public health advice, and then we'll hear from Jerome, who'll take us through the outbreak update for today, and then the four of us will be happy to answer any questions. Professor Sutton.
Thanks, Acting Premier. Good morning, everyone. Certainly we're making progress. This is another step forward for regional Victoria and Metro Melbourne. As we flagged last week, there was an expectation that Metro Melbourne could, by and large, go to the regional Victorian settings, and that's what's happened here. We do have to bear in mind that the risk is greater in metropolitan Melbourne. That's where our cases are. That's overwhelmingly where our primary close contacts have been, and that's where transmission is still occurring. But metropolitan Melbourne can go to those regional settings by and large, and regional Victoria can go to more liberal settings as well. That's all in recognition of the fact that there hasn't been transmission in regional Victoria, but we are opening up the state, and there will be people travelling from Metro Melbourne, as you'd expect, into regional Victoria. So we still need some of those constraints in terms of the size of gatherings in various settings, in various locations, to be able to manage the risk should a case occur there. We do know that we're still getting cases. They have been linked most recently, and some of the cases that were initially unlinked over the last week or so, really we've got a pretty good idea of their connection to existing cases. But if I reflect on the Reservoir household, the Queensland couple, and even the case in Kings Park, who was neighbouring to a case but didn't know that, we've got individuals who are not aware that they were primary close contacts or secondary close contacts, who've done the right thing, had symptoms, gotten tested and isolated, and we've been able to link them back again, but they didn't know that they were cases. And so we have to work on the basis that we may yet still have cases in Metro Melbourne and potentially elsewhere who are infectious, who don't know that they're cases and who move about. And so these restrictions are a reflection of being able to manage that risk of transmission. The snapback to COVID normal, if you like, that we've had previously, we're not at that stage yet. We're moving by safe and steady increments with a view to continue to ease restrictions as we go along, as we run down these last few cases. But bearing in mind that there may well be cases out in the community, we still need to push that message that anyone who's symptomatic at any time, including if you've been tested maybe a couple of weeks earlier, to still get tested again, to make sure that we find every single case that's down there. Those cases that have been found in the last week or two are by virtue of people testing because they're symptomatic. That's a really, really key proposition that we need to continue to prosecute. But I'll hand over to Jerome and happy to answer questions.
Thank you, Brett, and good morning, good afternoon. In terms of with the new cases announced today, that's now a total of 85 cases identified as part of the Kappa outbreak and 15 cases in total for the Delta outbreak. Of course, 55 of those cases combined are still active. We're making good progress in terms of rolling up the established parts of the outbreak that we've been talking about for the last 3 weeks. 93% of the primary close contacts for the city of Whittlesea have now all been cleared. 90% of the West Melbourne primary close contacts have been cleared, 88% of those associated with Port Melbourne, and 82% of those associated with the R-Care aged care facility. So really good progress, and again, I add my thanks to all those people who've been doing the hard yards of isolating to support us in closing down those outbreaks over the last 2 or 3 weeks. We still have a very active response around the Kings Park in South Bank, the complex there. We have now around 163 residents that are isolating. We have a significant set of support services on site there. I was briefly there myself this morning, and my thanks to all the residents for entering into this difficult few weeks as they go through the isolation period to make sure that we can run any remaining traces of the virus to ground in that particular complex. We've had over 380 PCR tests conducted there over the last few days, so both the residents of the complex and the surrounding buildings, so people have really come forward in good numbers, and that testing station that we put up there will remain on site for the next few days to ensure that anybody in the area who wants to get tested can do so. And I'd encourage anybody, of course, particularly in that South Bank area, if you have any remote symptoms or any concerns at all, we'd please like you to go and get tested in the facility that's there now. As we've confirmed earlier, we now have a total of 8 positive cases associated with that complex. The number of those, the first family, have all now gone positive. We have 2 adults who we identified yesterday, and of course the 2 original cases who were associated with the R-Care outbreak. A number of those people have moved into hotel quarantine, and my thanks to them for doing that. And a number of our primary close contacts in there are also relocating, as is their desire. In terms of, there are a number of exposure sites we've identified in the last 24 hours associated with the new cases we identified yesterday, particularly the two gentlemen in the South Bank complex. Those exposure sites include the Padre Coffee shop in the South Melbourne market and various facilities at the South Melbourne Central, both on the 12th of June, and the Sakura Kaiton Sushi 2 at 282 Lonsdale Street on the 13th of June. Those are our exposure sites of primary concern. If anybody has been to those exposure sites on the date and times set out on our website, then please, we'd like you to get tested immediately and to isolate and contact us so we can support you. There are also some Tier 2 sites identified on our website. I'd be grateful if, again, people could check those to see if they've been there. We're also identified late last night a new positive case, a nurse at Epping Private Hospital. This is one of the nursing and caring team who were supporting the 3 aged care residents that were relocated there about 10 days ago. We're obviously very concerned about this new positive case. There's a full incident response team that's working through the circumstances. We understand at the moment that the nurse worked 2 shifts on the 9th and 14th of June. We believe she may have been infectious for the 2nd of those shifts. We're, of course, working to support her, all the primary close contacts around not only the Epping Private Hospital, but any other contacts that she may have. And as more information becomes available, we'll share that this afternoon, and I'm sure at the update tomorrow morning. I can confirm that all the staff at Epping Private Hospital that are working in this active area have all had at least their first dose of vaccination, but I'll provide a further update on that tomorrow. In terms of vaccination, another solid day of vaccinations yesterday. Obviously, we're very pleased to not only to launch the online booking portal, but 12,700 people used that yesterday, primarily in the afternoon, to make their bookings in the days ahead. My thanks to them for doing so. And I'd encourage anybody who particularly has their 2nd dose coming up to either go online and use the booking portal to book your 2nd dose vaccination, or to call our contact centre. As a result, of course, waiting times at our contact centre are now very short, so if you need any help, then please call them. You can, of course, use the booking portal to book your first doses. There are not many slots available in the next few weeks, but there are some slots available further ahead. So if you're eligible to get your vaccination, then please check the availability and follow the instructions. With that, the four of us will take any questions you may have.
Other 3 cases that were reported overnight, are they linked to the South Bank complex?
Yes, that's right. So we declared essentially 5 new cases in the last 24 hours. So 2 of those we talked about yesterday morning. They were the two separate males in the South Bank complex in apartments close to the other positive cases that we've seen. 2 of the other positive cases that we've identified in the last 24 hours are family members of an existing family that's already been declared positive at the South Bank complex. So that as a family of 4, they are now all positive. And then the 5th case is the nurse at the Epping Private Hospital.
Is it fair to say that if you'd locked down this complex 2 weeks ago, we wouldn't be dealing with this spread now, or if at the very least you had required people in that complex to get tested, we would have nipped this in the bud earlier?
Look, I don't think so. I think what it does highlight is how important the circuit breaker has been in terms of minimising movement. So as a result, we've seen that the people we've identified most recently, both at South Bank and the cases that have emerged in the last 10 days or so, have had far fewer movements in the community and therefore far less risk of spread and onward transmission. I think that's the first thing I'd say. I think secondly, look, we always go through we always go through a process with any positive case, as we did with the R-Care staff member who was the first positive case in that community, around her movements, around any contacts they may have had, around their primary contacts. We did a fairly extensive testing blitz around her and all of her primary close contacts. Her partners identified. It was only when the second individual came forward a few days ago, again, a symptomatic individual who came forward because he was symptomatic, that we identified that there was a wider spread at that particular exposure site. We had no knowledge at that point that there was wide other exposure going on, no real reason to believe based on the characteristics of that facility. But as the evidence becomes available and as we see more information, we respond appropriately. We've seen a really good response over the last 2 or 3 days with our very visible on-site presence. Numbers of people coming forward to get tested, and I think we've adjusted our measures to suit the circumstances on the ground.
Would this change the way you responded to a case in a similar setting in future, particularly as we open up and hopefully can maybe prevent the whole state having to lock down by locking down a building?
Sure. Look, I think as we've done over the last 16 months, we always adjust our response based on the evidence we see on the ground, on the information we have available to us, and based on the experience of what's happened in the past. So I think every single step we've taken in the last 3 weeks on this outbreak, we've always sought to get that balance between what's proportion, what's the right thing to go and do. I think in this case, given how we're seeing, again, a kappa outbreak, never been run to ground before in a zero case environment, and a Delta outbreak, again, never been run to ground before in a zero case outbreak, I think we've handled this well, and crucially with the support of the wider community, because people have come out and got tested in large numbers, and people have done a fantastic job on the whole of staying isolated when we've asked them to go and do so. Over 8,000 PCCs. I think it's a huge ask of those people to do that, and they've done exactly that. So we're very pleased at that. There's obviously still more work to do, and whilst we still have positive cases in the community, our work will continue.
And just one more on this really quickly. I think the first exposure date for this complex in South Bank is the 2nd of June. I think the original R-Care case tested positive on the 30th. Is that correct? Essentially, is the 2nd of... Are you saying that you're worried that people were infectious in that building from the 2nd of June onwards?
Yeah, look, the exposure period we're looking at is between the 2nd of June and the 14th of June. That's the earliest positive case when the first R-Care staff member identified positive. We know that there is, we have very strong grounds to believe there is evidence of transmission between herself and her partner and the second family to go positive in that particular unit. That happened at some point subsequent to the 2nd of June. We continue to, that's what we've worked on with all the people that we've tested on that site. I am pleased, we've had over 300 or so test results back now for people not only in the facility but around the facility. We've identified as a result of that the new positives in the last 24 hours. We'll continue to test, of course. People may present later, but we feel we've got a strong grip on that location at this point in time.
So is this the way, though, to do it, to run down locally, like you've just been explaining, instead of resorting to lockdowns? So is this the model that you'll take into the future to avoid lockdowns?
Well, look, and it's a matter for Brett in terms of the broader strategy, and it depends on the context that we're working in. We're now in a situation with this outbreak. Bear in mind, when the first person tested positive as part of the City of Whittlesea outbreak, over 3 weeks ago now, 3 and a bit weeks ago, we already had 24, 25 people who had been infected before that person got their first test. So the cluster had already been widely seeded at that point in time. We're now at a point where we can see over the last 7 days or so the number of cases coming down, the number of sites becoming far more controlled, the number of new exposure sites becoming more controlled. But we still have more work to do. The Epping private case is of real concern to me this morning. We've got a lot of work to do to support her and to make sure we understand any other transfer risk. But again, we're coming at a context of where we've had the benefit of significant restrictions in place on her movements. That will mean fewer contacts in the community. It'll mean reduced risk of spread. As we go forward, as the restrictions ease, there'll be greater risk, so we all need to be on attention. And as the Premier said, the most important thing people can do is get tested, because that's the way we catch these things early.
A number of residents have said that there was ventilation in the hallways, but it was turned off.
Yeah.
I guess, is this kind of a warning to apartment blocks that, it is airborne and it can get through if you don't have proper ventilation?
Yeah, look, absolutely. As we've seen over many months now, this is an airborne. This virus can transmit through an airborne environment. That is a real challenge for us. That's a real challenge for all of us. That's why it's so important that we get back to zero. What we want to get to is to ensure we have no community transmission, so we do not have to be continually concerned about this risk. Until we are confident that we've run all these cases to ground, all of us need to be on our watch, and we all need to get tested when we have the slightest symptoms.
Jerome, why was the decision made to not lock down that building when the first case presented?
Because at the point that the first case presented way back in the beginning of June, the evidence of her transmission, the evidence of the people she'd had contact with, was very clear, and those are the people that we tested and followed through. When the second case came forward, we identified another risk of exposure, another risk of transmission, and that's when we widened the net. Every single time we go through, we identify a new positive case, and as we've done on this one, we've identified over 8,500 primary close contacts through that very deliberate approach. You saw the same approach we took with North Melbourne Primary School, where we progressively expanded our zone of operation. We will continue to strike to get the balance right, but I think the evidence of these outbreaks is that we've responded extremely swiftly. We've responded proportionately. And actually the community's done the right thing. Every single time we've asked people to come forward to get tested or to isolate, people have responded really well, and that's allowed us to be in a position we're in today.
Start about rationale for some of these restrictions, possibly for Brett. You've outdoor, non-seated outdoor venues can have up to 1,000 people, but there's no spectators allowed for community sport in Melbourne. How does that add up?
So, all of this recognises that regional Victoria is in a better position, relatively speaking, to Metro Melbourne. Regional Victoria has not had cases in recent weeks, for some areas for months. Metro Melbourne has had cases today and really most days in the last few weeks, with new exposure sites being generated, with new cases coming forward who were not aware that they were cases, who were infectious out in the community. Having a large gathering with strangers coming together poses a risk, while that is still the epidemiological situation in Metro Melbourne.
But I'm talking about this is Melbourne. You're allowing outdoor venues of no more than 1,000 per space, but no spectators at community sport. I mean, you're not going to have more than 200 people at some community sports games.
We are trying to allow community sport to go ahead with the minimum number of people attending as possible. So the sport can go ahead for all of the benefits of sport, but to have a discretionary element of spectators is not the point that we're at in Metro Melbourne now with the current epidemiology, and for all the reasons I've just said.
And why the special rules for COVID testing to go to the ski fields? And how far, is it just the mountains, or is it communities like Bright around it?
It'll all be in comms when it comes into effect, and we'll clarify that, but it is defined to those alpine resort regions, and it does relate to the fact that the industry has to be protected. We need to make sure that there are no cases that go up on the mountain, even though the number in Metro Melbourne may well be tiny. A single case who's infectious up on the mountain would be a potential super spreading event. It's essentially how it spread across Europe in March of last year. It has been demonstrated in resorts, Whistler, Aspen, other West Coast Canadian towns where significant clusters have occurred because of all of those combinations that I've talked about so many times: indoors, post-exertion, no mask wearing, with strangers, and that combination of cold and humidity that all come together to make it a higher risk environment. So it's a small thing to help manage that significant risk.
When can we get football back at the MCG and Marvel? With crowds.
As soon as possible is the short answer. As soon as possible. I still don't know what tomorrow will bring, what the next day will bring. We are clearly looking to make changes on a week-by-week basis. We will look to the end of next week for those very reasons. And you know, the fact that footy's going ahead in Geelong is a sign that we can move to exactly those kind of settings down the track.
So we could be without football in Melbourne the weekend after next.
I'm hoping that we can get footy back to Melbourne as soon as possible. I don't want it to be deferred any longer than it has to be, but I don't want us to be in a situation again where there might be cases in the community going to the football with this Kappa variant or Delta variant in particular. You know, the Kings Park transmission is a demonstration again of people who haven't had face-to-face contacts, people who don't live together, work together, who haven't been in a restaurant together. We're talking about people who maybe have passed each other in a shared corridor, or who maybe have walked through the same space at different times, with the virus just sitting around as an airborne fog. That's the challenge, and I don't want that to be spread through a sporting event. So we just need to see how this week pans out.
Just one other one while I've got you. If you're for the school holidays coming up and you're flying interstate, particularly to Queensland, what's the situation there?
So just follow the rules of those jurisdictions. If there's no constraint, you're obviously allowed to go to all of those jurisdictions, but you need to look at what their rules are for people coming from the whole of Victoria, or indeed some of them just have Metro Melbourne as a hotspot effectively.
And on those ski fields, what kind of documentation do you need to prove that negative test? Is that a piece of paper or a text?
We think it's just the SMS message on your phone to show as proof. We want to make it as simple as possible.
Did you consider making it a wider requirement for anyone making an overnight trip to the regions?
No, I don't think so. You know, I think we're talking about settings in the regions that will manage that risk. It's not that ski fields are the only place where transmission can occur, but we want that extra level of precaution for those settings.
It's really hard for them to be kind of on tenterhooks for this weekly announcement that we've got going on at the moment. Why not come up with some kind of roadmap or plan similar to what we had at the end of the second wave last year, so they can at least plan for density limits, reopening, things like that?
Look, I think last year was extremely precautionary. We were coming out of a really huge second wave, and we looked at days and days of zeros or days and days without mystery cases before we changed. If we were going along such a conservative path, you could lay that out. We are trying to go back on a day-by-day assessment so that we can go back to ease settings as soon as possible. That's what makes it a day-by-day prospect for assessments, and we're still trying to flag those aspirations for week-by-week changes, and with an expectation, and I think a pretty strong expectation, that there'll be another level of easing at the end of this forward week.
When do you think we might be able to get back to what we were before this outbreak? Do you think, especially considering it's winter and people are mixing inside more, is that going to push it back even further, do you think?
I don't know that it does push it back further. I know that we need some days where we're really assured that our last cases are wrapped up, that there aren't new community exposures that are occurring. Winter will remain a high-risk period while we've got 3.5% of Victorians fully vaccinated or thereabouts. We need everyone to be vaccinated before we can really manage that winter risk. But all of those other things that we're talking about, checking in with your QR code, getting tested at the first signs or symptoms, and other COVID-safe behaviours are really critical right through this period, because we know people huddle indoors, we know people will have coughs and colds and might dismiss it. So we do need to just bear in mind that the risk will be quite high through the winter period until we can get high vaccination coverage.
Does that mean we're not going to be able to get back to those previous settings? Are you saying
No,
we
I'm
need,
not.
we need several 0 days in a row?
No, I'm not. I'm just saying that there's going to be a heightened risk of transmission right through winter. That doesn't mean that we can't go back to settings that we'll all enjoy, but it does mean that we're going through a period of greater risk, even as people are getting vaccinated, than over a summer period where people spend a lot of time outdoors.
Weddings can have 20 people but no dance floors, but funerals can have almost 4 times the number of people. Why is there a big difference between those two?
Look, I've spoken to it before. Funerals need to take place on fixed dates or relatively fixed dates. Weddings are very important occasions for people. I understand how disruptive it is to have a limitation on numbers for such an important occasion, but they can be deferred for some people. I know that there are bookings made, there are arrangements made, there's lots of planning that goes into them, but they're not the same as funerals in that regard. And I do expect that in the same way that the caps for weddings have changed with the public gathering limit, that they'll continue to change with the public gathering limit as we go forward. And so deferring to another week or fortnight ahead is an opportunity to have, potentially significantly more people there.
Are they higher risk weddings?
They are higher risk. We've seen outbreaks both through last year in Victoria with weddings, but there's international experience that absolutely supports that. People try and do the right thing, but of course there are strong obligations for people to attend weddings. People might minimise their symptoms because of that. And of course, hugging and kissing is normal practice in weddings. As much as you might say wear a mask at all times indoors, we know that people are going to be in close contact because of the nature of that event.
Do you have any data to suggest how many cases may have been prevented in the past week due to wearing outdoor masks?
No, it's really difficult for each individual intervention to know what a difference it makes. I do know that we're still seeing transmission in circumstances where you would expect that wearing a mask could make a difference. It is, it has been pointed out that fleeting contact has been a feature. How much that compares to other variants, we haven't got all of the data, but we keep seeing it. And if wearing a mask makes a difference between walking past someone and not picking up that virus and therefore being out in the community unaware of your status as a case, or completely protecting yourself, that's a useful thing. So we will continue to recommend masks when you can't physically distance.
So are you saying that fleeting risk is lower this week than it was last week?
I think the risk is going down by increments week by week. We are running down these last cases. They are linked. We have linked previous cases. We're not seeing cases of unknown acquisition that we can't find any source for. So by increments, the risk is going down for sure.
How strong is your belief that there are cases out there that we haven't picked up yet? Jerome's touched on it recently, and how has that impacted?
It is hard to know. We've got reasonable testing numbers. I wish it were in the 30,000 mark, 40,000 mark still. I know that people in Port Melbourne, South Melbourne, Melbourne Central will pick up with testing today. That's a good thing. I know that people will look at those exposure sites that are especially focused around Port Melbourne and South Melbourne and will come forward for testing. But we want broad testing because you could still be in a suburb where you look at active cases near you, you think there's no risk, and you therefore don't get tested. So there is absolutely a possibility of cases still being out there undetected. We've seen that just in recent couple of weeks.
Is it concerning to you that a nurse is tested positive despite receiving a dose of the vaccine, or are we going to see this as we get more vaccinated?
We will see it from time to time. The vaccine provides protection. It's an absolute must. It's a must for healthcare workers. But it is not a perfect solution for protecting oneself. And so that Tier 3 PPE is still a recommendation for Melbourne and Victoria right through this period. So, the N95 masks are that additional protection, but vaccination is something that's going to protect healthcare workers and everyone. In addition, it is not a perfect protection, however.
Do you know if they're asymptomatic or...?
No, the nurse did develop symptoms, and so that was, that was a good indicator of when the infectious period, being 48 hours prior to that, is likely to have started.
How frequently are staff being tested in that ward?
I don't know. We'll get details through the investigation. It was only midnight that the case came through for us.
And was this nurse treating any non-COVID patients?
That's right.
So was she treating any non-COVID
Oh,
patients?
no, as far as I understand, in Epping Private, she was on the COVID ward.
Given winter is a lot more high risk and our second wave was during winter last year, do you think we might be able to see masks indoors for the whole season?
Look, I think we'll think it through, depending on how cases go. But we want to maintain, people being engaged in those behaviours. We don't want to fatigue people. If it's a case of some specific high risk settings, of course we've kept that in mind. That's been our advice on public transport, airports, and rideshare right through. But we don't want people to be fatigued by mask wearing and basically not doing it and seeing others not doing it. So we have to balance those things.
Will you be attending PAYAC on Friday?
No, I'm not attending PAYAC. I believe it's a budget PAYAC, so it's not for me as far as I understand.
On gyms, can you provide a little bit of clarity around gyms? Is it 50 or 10 people who are allowed indoors?
What?
Some gym owners are just saying, can they have 50 people indoors at a gym? Have they understood the rules correctly, or is it?
It's a DQ4 setting for gyms in regional Victoria, as I understand it.
What about city?
DQ4 setting as well.
It says maximum indoors 50, but maximum group size 10 people indoors.
So group size is a booking size for an exercise class, for example. So that's not a venue limit or a setting limit. That's a group booking limit.
Can I ask you a question?
Sorry, just one for Victoria, if that's all right, just quickly. What's the health advice behind the decision to open with no outdoor venue limit amusement parks in Melbourne, but there's no spectators at stadiums for footy matches?
So that there's still a limit for the venue for outdoor amusement parks. Outdoor sporting events are different, with a significant number of people gathering. There's going to be a limit to those amusement parks, which manages that risk.
Is it more COVID safe, an amusement park?
An outdoor setting within an amusement park is more COVID safe than indoor settings, but
than a stadium?
No, not than a stadium per se, but people are not going to go to a stadium with 50 people or 75 people for a big match. We want to get to a point where we can make a recommendation around proper crowds for those events.
So what would be the baseline of crowds that you think would be the next step to allow?
Well, the Geelong proposal for this Friday is at 20%, so there'll be 7,000 people there. We'll work by increments for venues in the city in the same way.
And just quickly, Brett, did you push for a third week of hard lockdown last week? Was that something you were hoping to get over the line?
No, look, everything that we've done has been on my team's advice and my advice. So what you see is what you get. The settings that we've gone to has been the advice from me and my team. And
you feel comfortable with the relaxation that we're going to now?
Yeah, look, I want to re-emphasise to people that it ain't over yet, by no means. So, please don't go back to behaviours that would suggest that there's absolutely no risk. The new exposure sites today are a reminder for everyone who's been around South Melbourne Market and other exposure sites in that area that these exposures can pop up, and so we need to remain vigilant, including for mask wearing at the moment.
Are you concerned that compliance levels are dropping, and even in this past lockdown, are you concerned that people have been flouting the rules more so than other lockdowns?
It's tough. It's really tough. This is 16 months into a pandemic. There's no question that people are over this, and how do you maintain such behaviours over 16 months? It's a huge challenge. That said, Victorians have done it so fantastically. The testing rates, even though they're in the 15,000, 20,000 mark, have still been higher than so many other places, and on a per capita basis has been fantastic. That's still turning up cases for us that allow us to manage it. So, my congratulations for Victorians, but yeah, enormous sympathy for all of us around how long we've had to put up with this awful virus.
But does that suggest that we need to ditch lockdowns for good and learn to live with this in our community?
Look, learn to live with this virus has been interpreted in different ways. If learn to live with it means that we just have normal settings and we don't worry about how we manage an epidemic increase in cases, we will see tens of thousands, hundreds of thousands. Even with 60+% of people in the UK with one vaccine, they're looking at 10,000 cases now. They're wondering if they're going into a third wave with up to the 60,000 cases per day that they had in their second wave. So we can manage this down to zero, and I think we absolutely should, because that will give us the assurance that we can actually ease our way of living in a way that gives us confidence of being safe.
What do you make of cities like New York and LA opening up, getting rid of restrictions despite not being at 70 or 80% vaccinated?
Oh, they're very close. I mean, they have driven their numbers down. They've driven their deaths down very, very substantially. Of course, the United States has had over 500,000 deaths. It's a public health tragedy through the last 16 months. But when you look at cities like San Francisco that have got some of the highest city levels of vaccination coverage, restrictions are off effectively. People are living normal lives and they are not having their health system overwhelmed. We should look to the effects of that high vaccination coverage as something that we need to get to, and the sooner the better, obviously.
Speaking of vaccinations, a lot of multicultural communities over 50, we've noted, are very sceptical about the second jab, and we're trying to access them. But is there any program you've got in place other than engagement, to particularly in the aged care setting, where we ravaged it last year?
Yeah, we do. We continue to have online and other engagement with multicultural communities. The second jab does provide a really additional level of protection, so it is an important one to follow up with. For AstraZeneca, 12 weeks later, it'll give you that longer term protection as well as that higher level of protection.
Talking more about the fear they have. I mean, I don't dispute the jab. I'm saying our communities are scared of this.
I mean, we have to address people's concerns on a case-by-case basis. People come at with their doubts through various motivations. Some have seen online misinformation and disinformation. Some of it will relate to absolute fantasy. Some of it will be a kind of twist on a genuine concern around clots, for example. We need to address each and every one of those with an understanding of where those concerns are coming from. It is not simply a case of providing information. We know that that's not the whole story in engagement on vaccine hesitancy. You need that nuanced, repetitive and deeply engaged process so that we can address people's concerns properly.
People who go to the snow before they've got to test before they go to the snow, what happens then? Do they have to isolate until?
No, we're essentially asking people without symptoms to get a test, or everyone who's attending alpine resorts to get a test. They can head off, but they need that negative result before they can enter.
Sorry, just one more on vaccinations. Are you disappointed that the federal government hasn't come out and given a plan or a roadmap of where we'll be in a couple months' time when more people are vaccinated? Oh, look, I empathise with the supply constraints globally with this vaccine. It is entirely a matter for the federal government as to how they map out vaccine coverage, but there are genuine supply constraints, and in a rather volatile global situation where everyone wants those vaccines. So, to the extent that that supply certainty can come about, that'll be great. But as I understand it, Victoria, as for some other places, has greater demand than supply, and so that is a genuine constraint. I wish it weren't the case, but it is. But everyone wants us to get to a place where we can have high vaccine coverage and lead our lives differently.
Mr. Molino, can I ask you a question? What's the reaction from business groups that you've spoken to about the latest easing of restrictions?
I think the engagement with industry, the engagement with community, with artistic organisations, we want to ease restrictions as carefully but as swiftly as we can. And so from hospitality, for example, it's around the density quotients, and I think the easing of restrictions that we've announced today, both for regional Victoria and for Melbourne, for the 25 patrons for smaller venues before the density quotients kick in at a metropolitan or a regional venue, I think will be well received. You know, we absolutely understand from a business point of view, community, sporting clubs, elite sporting clubs, theatres, everyone wants to get back to where we were several weeks ago, and this is an important step forward to get us there.
Western Australia is rushing through urgent law changes after the police there accessed QR code check-ins in a murder investigation. Apparently Victorian police can have similar access. Does that concern you?
Well, in terms of access to QR codes, just a few important things to note, and then I might ask Jerome to supplement my comments. In terms of QR information, one, it's encrypted. Secondly, it only lasts for 28 days. And if there's any request for access to that data from Victoria Police, that will be via a court order. But I might ask Jerome to speak in further detail about that.
Have there been any requests from police for that data that you're aware of?
Not that I'm aware of, no.
Thanks, Luke. Yeah, so look, the QR code data is all held entirely secure, as the Acting Premier says. It's entirely encrypted. It is only held for 28 days. We only access the QR code data in the event of a COVID investigation. If we have a positive case, if we have grounds to understand what has been happening in that location, it is not shared with any other organisation. And as the Acting Premier has just confirmed, if Vic Police did want to have access to QR code information, that would be via a court order.
Jerome?
Emails after booking on the online system?
Yes, I think if you book on the online system, then as 12,700 people did yesterday, then you get a confirmed slot of your choice of your vaccination. I believe you get an email confirmation as well. I've not yet done it myself. My second dose isn't due for a while yet.
The app, is it possible to get like history of where you've checked in? I know a lot of other states have it with their app.
Not that I'm aware of, no.
Is it something you're looking at doing?
No. I mean, the purpose for the QR code system is very simple, and I think what we've tried to do over the last 4 or 5 weeks is to really simplify the ask around QR codes, which is it is solely there for us to defeat COVID. It is solely there so as we start to ease restrictions that we've got a safety net that says in the event that we still have active cases of COVID, and the chances are that we will still in this very precarious place for many months ahead, that we can contact trace quickly and we can get hold of it quickly, and we minimise the need to go into any other restrictions. That's the purpose of it. That's why we want to make it as easy for people to comply with the QR directions as possible. Simple application, but it's not there to do anything else. It is just purely there for that purpose.
But if we had the history, you could, you've been to an exposure site, you could go back and have a look and go, oh, I was there, I should go get tested. Could it serve that purpose?
Yeah, that's not something I think that we're working on at the moment.
Jerome, can you just clarify how many staff at Epping Private have been furloughed? And are you aware of the extreme wait times at a number of those Port Melbourne area testing sites this morning? I think it's 4 or 5 hours for a few.
Yeah, that's right. So just on the latter point, so I was at the Kings Park complex this morning, and look, we've got 3 pop-up testing stations now there. There has been quite a wait this morning. I know people are really keen to come forward and get tested. I thank them for doing so. We've got all of our 210 testing sites set up across the state. As we've done now many times before, I'd urge anybody who's going out to get tested, please check the waiting times. There's much less demand on the sites, obviously adjacent to the Port Melbourne, South Melbourne area. But I think, as Brett said earlier, look, this is, I'm afraid, exactly what we need people to do. When we have concerns about COVID circulating at South Melbourne Market, South Melbourne Central, in and around the South Bank, then we do need people to look at those locations and please come forward. If you've been to those locations, come forward and get tested. And if you've got any symptoms, wherever you are in the state, please come and get tested.
Sorry, just how many staff at Epping Private?
Again, the investigation's ongoing at the moment. We'll confirm some details, I think, this afternoon and certainly tomorrow morning.
A question for the Acting Premier. James, given there's lingering restrictions for a lot of hospitality, gyms, some of the arts particularly, will there be more financial assistance made available in the long run, because this is continuing to affect bottom lines?
Rich, there's constant engagement with industry. I know the Treasurer, the Industry Support Minister have been engaging with the Alpine Resorts and hospitality and other areas of industry. I've got no further announcements in terms of business support. We've, over the last few weeks, announced more than $500 million in business support, as well as other important supports for particularly vulnerable Victorians in this very difficult time. I've got no further announcements, but it's fair to say that just like everyday public health, is analysing the data and the outbreak and how we're going in terms of getting in front of it. Every day we're engaging with business and industry. We know that this is an extremely difficult period for everybody, and that's why today, being in a position where we can bring regional Victoria and Metro Melbourne much closer together, getting rid of the 25k boundary, having the easing of restrictions for hospitality. I think this is welcome news. We're not where we want to be because the outbreak is not over yet. We've got to get to those remaining cases. We've got the Public Health have got the confidence to provide advice to government that we can make these easing of restrictions. As we indicated for the last week, we were always on track to have further easing of restrictions announced today.
When you announced this this lockdown, the circuit breaker was designed, and the rationale behind it was go hard now so we can snap back quicker. Was it wrong to sell it that way because we're still having lingering restrictions?
Well, every outbreak is different, Rich, and you know we had this outbreak which originated from a hotel breach in South Australia, a variant that was 50% more infectious. Then during the period of the lockdown, there was the Delta outbreak. So you've got to respond to the reality on the ground. The initial advice from Public Health was that we needed the 7 days, but the sheer number of primary close contacts, exposure sites, the time that this virus was out in the community meant that we needed to have that a bit of an extra period longer, as well as careful easing of restrictions over the last week or so.
Just back on business assistance, it's my understanding that June 3 was the deadline for applications for small business grants, but that money is yet to be paid. That's more than a fortnight ago now. What's going on there?
Rachel, I'm happy to come back if there's any specifics. We had the applications open for a period of time, and money would flow back to businesses. If there's any particular issues, I'm happy to follow up.
On business as well, big business groups, so VECI, Australian Industry Group, Hotels Association, also they want to be brought into discussions around restrictions more. They want to know what more they can do to open up more quickly. They want a more pronounced role, and they say that things are different now to last year without support mechanisms like JobKeeper. It's affecting workers and employers a lot more. What do you say to those groups who want a more pronounced role in how things are tracking?
Yeah, look, it is a different environment and a harder environment without that income support that was provided through JobKeeper. We only had the income support from the Commonwealth for a very short period of time just for metropolitan Melbourne, so just for that week. So I understand how difficult this is, and that's why it was such a significant business support package that we've announced over the last week or so. In terms of engagement with industry, as I said before, there's a high level of engagement with industry, whether it's particular businesses or particular sectors of our economy, in terms of implementation of easing of restrictions, that engagement, or what further assistance may be provided, whether it's through industry support or whether it's through Martin and the Department of Health.
Do you really think that you're doing enough? There are still these big business groups that come out every week after these restrictions and say, it's not enough, we're in the dark, what more can we do? Do you really think that what the government's doing is satisfying them and is as much as you can do?
Look, I can talk to the engagement that I have with my colleagues in Cabinet and their engagement every day with industry. If there's more that we can do, I'm happy to look at it.
Can I just ask something closer to where you live, the hills and the storm damage and so forth? People haven't got water, they can't drink the water, they've got to go to central spots. Can anything be done in that area to get these people back to somewhere near a normal life?
Yeah, it's this is my community. It's where I live. It's where my extended family live. We got the message this morning not to drink the water in my house and in my community. So I see the devastation, and when I was standing up with Tim Waybush, the SES Chief Officer, the other day, and he described it as tree carnage, that is exactly what we've got. We've still got more than 10,000 people without power. We've got almost 6,000 requests for assistance just in the Dandenongs and the Yarra Ranges alone. We've got hundreds and hundreds of volunteers. So I've been out in the community talking to the Emerald SES, yesterday Emergency Management Commissioner, CRISP, as well as Danny Pearson, the Acting Minister for Emergency Services, was out in the community. I had a long conversation with the CEO of Yarra Ranges about what additional support that they require. This is massive damage right across the hills, and I'm chairing a Security and Emergency Management Committee of Cabinet later on today, and we will look at what other supports that we can put into place. This is quite a significant area of destruction right across the hills.
Is 7 days without power good enough, and will the government consider maybe undergrounding more power lines in that area to prevent this happening in the future?
Rich, I've got no announcements in terms of big infrastructure responses like that. We've had a program across multiple governments, across multiple years, in terms of identifying areas of high bushfire risk, in terms of cabling, power, and in some parts including undergrounding power. The assessment of the damage is taking place right now. So it's a bit early at this stage to talk about the extent of the damage and what will be done in response. Right now it's about emergency operation, relief and recoveries kicking in, personal hardship grants, re-establishment grants, local government and government agencies are assessing the damage as we speak.
But is 7 days good enough for communities in?
7 days is an incredibly long time, and for some households it may well be longer than that. So as I said, I've got an SEMC meeting later today. We're looking at what other supports we can put in place.
Does that include asking the ADF to come in and help if they're not already?
So all of those responses, Rich, that is available to the Emergency Management Commissioner. So EMV makes that assessment about what additional resources need to be brought in, whether that's our forest fire management resources within the state government, whether that's asking for ADF support. So that's within the scope of what Emergency Management Victoria can ask for, and that assessment's being made as we speak.
Just back on PAYAC, Professor Sutton said he won't be attending on Friday because PAYAC is to do with the state budget. Surely the decisions he's made over the past couple of weeks have had a pretty significant bearing on the state budget.
Look, these are, and I might ask the Minister for Health to respond, these are budget estimates about budget decisions of government. And it's appropriate that the appropriate people from the department appear at PAYAC alongside the Minister, but I might ask Martin to respond.
Thanks, Acting Premier. So the Public Accounts and Estimates Committee hearings going on right now are into the current budget, and the Department of Health will appear this Friday, as I understand it, and the most senior officials in the department, all of whom have a direct accountability for a very substantial budget, will be there to assist the committee in their work.
Haven't the decisions that health experts like Professor Sutton have had to make over the past couple of weeks had a huge bearing on the state budget, though? Shouldn't they be there to account for those decisions?
All of the operational staff who spend the Department of Health's substantial budget in our health networks, in our public health networks, in our local public health networks, in our community engagement programs, a multiplicity of them in the billions of dollars that the Department of Health allocates through the budget. All the relevant and indeed the most senior officials will be there to answer those questions. People like the Chief Health Officer are absolutely critical to that public health response, but they're not accountable in terms of what the Public Accounts and Estimates Committee are looking for. The most senior officials are, as indeed am I.
And Minister, just on another matter, given that the Mornington property linked to you sold for $1 million over the reserve price to someone who's the director of a company which currently holds a contract for contact tracing in Victoria, what measures will be put in place to ensure public transparency when it comes to the renewal of contracts?
So I'm not sure what your line of questioning on this story is. I answered the question yesterday. In regards to that particular contract you're referring to, that was a contract that was entered into by the department well before I was Minister, and I will continue to take the advice of my department on all commercial and probity matters.
And do you have a personal relationship with Rodney Kagan? Did you ever meet privately to discuss the sale of the property?
No.
One more question, please. Professor, just on a bit of a lighter note, once we're out of this, what are some of the things that you're most looking forward to doing? Are you looking forward to going to the footy again? Are you, what's on your list to do once we're out of this?
Probably seeing friends and family interstate, having time not working would be my two priorities. I've got lots of family overseas as well, so if we're looking to the medium and longer term, I, like so many Australians, desperate to see some, close family who are the other side of the world. But, so many of us have similar aspirations through such tough times.
Something that lots of people talk about during these outbreaks, and it's something that's been mentioned by the crossbenchers as they negotiate these laws to replace the state of emergency as well, is kind of setting up thresholds or a traffic light system to kind of say when we get to this condition then these restrictions come in. How feasible do you think that is, considering how much of a changing feast every outbreak is?
Yeah, I don't know. I think, that it's a really complex issue around having some kind of fixed threshold. The circumstances change every single day, and there's a multiplicity of inputs and considerations that need to be made to make sure that you're acting in an appropriately precautionary but proportionate way as well. Those principles are embedded in the Public Health and Wellbeing Act. But it doesn't lay out the specific details of you will act at X or Y, because I think that's almost impossible to do. But obviously, very happy to go back and forth with the public health advice on what's feasible or reasonable or what our perspectives are as that legislation gets discussed and drafted.
And just one specifically on the rules. If you're from Melbourne and you go into regional Victoria for a holiday, are you bound to the Melbourne rules, so you have 2 people with you, or can you have 5 people?
No, it's the venue and where you are. So regional Victoria settings are the settings that apply in that regard. So if you're booking your holiday and you're the household that's now in regional Victoria, then 5 adults and their dependents can join you in that accommodation.
Is that the same with weddings? So if a Melbourneian gets married in regional Victoria?
Yeah, so it is where that wedding takes place as to what the caps are. Thank you.
Thanks.
Thank you.